Help your therapist to help you. Hello, hello, lovely people. Welcome to my virtual couch. Happy Friday to you all. I am feeling a little bit under the weather, so bear with me. So, in my last video, I talked about what to do if you're looking for a new therapist or looking to switch therapists and how to navigate that. And I also gave you all a list of resources to look for a therapist. So, I hope you all were able to find that helpful. Okay. So in today's video, I'm going to talk about the first session, which is the evaluation or the intake, what to expect, questions to ask, and then moving forward in the next step. Okay. So I would recommend before you go into the evaluation, make sure that you write things down because it can go by very fast. Now, usually the evaluation is about 45 minutes to an hour. I've had clients say to me, oh my goodness, like where did the time go? Like it went by fast. And you don't want to leave the session thinking, oh my goodness, I forgot to bring this up. Okay, so I would recommend you write things down. And specifically, I would recommend you write what your goals are in therapy. What are you hoping to accomplish in therapy? Okay. So before you walk into the next session, or if the session is virtual, take a couple deep breaths, take a sip of water, breathe. It's going to be okay. You have made the first step. Good for you. Okay, so the therapist may ask you, what's bringing you to therapy today? And that question can feel very overwhelming because you might have so much on your mind. You might think, where do I even start? But that's fine. A good therapist should be able to help you navigate why are you here in the first place. I would recommend think about what made you decide to make the first phone call. So yeah, you may have a lot of stuff going on, but there's usually something that might trigger you to pick up the phone and say, I really need to talk to somebody. So what was that for you? Sometimes clients might say, you know what? I've been feeling a lot of stress, but one day I just blew up. And then I decided, okay, you know what? I need to talk to someone. Or a client might say, you know what? I know I've been having issues with my boyfriend, but then one day we had a huge fight and I decided, okay, I need to talk to someone. So the therapist may ask you, what are your symptoms, right? So think about when you go to a doctor's office and you go there for a cold and the doctor might say, what are your symptoms? Might be headache, running, a fever, runny nose, whatever it is, right? Same thing. What are your symptoms? Well, maybe I can't sleep at night. Well, maybe I notice I'm more irritable. Or maybe I don't want to be around people. Or maybe I just noticed that I'm not eating as well as I should be. You have symptoms, scan your body, take a minute to think, and then let the therapist know. Okay. So the evaluation involves a couple different aspects of it. And the evaluation sometimes can be a little bit lengthy. The therapist does not cover everything in the evaluation and wants to continue the next session, that's completely fine. The evaluation can consist of your background. So what is your background? Talk about your childhood. What was life like growing up? Who was the responsible for being your caregiver? What was life like in your teens, in your adulthood, things like that, right? Like, what is your background? Your mental health history is also going to be talked about in the evaluation. So, is this your first time in therapy, or have you had therapy before? Have you ever been on any medications for mood or anxiety or depression? Or maybe this is something that somebody's telling you to come to therapy, right? Like, okay, everybody's been telling me that I need to come to therapy, so now I'm here. Most important thing that the therapist is going to assess for is safety. So, for example, do you feel like harming yourself or someone else? Don't be offended by the question. The therapist is just getting to know you, and the therapist doesn't know what you've gone through. So, they're going to assess for safety. Do you feel like harming yourself, or do you feel like harming somebody else? Be honest and transparent so that the therapist can help you. Help your therapist to help you. Okay. The therapist is going to want to know about your substance history. So, do you drink? Do you smoke? Do you notice that your smoking or your drinking has increased because of stress? Are you self medicating? Past traumas. Okay, so what are the past traumas that you have? Sometimes people have a difficult time identifying what a trauma is. So, trauma is any disturbing or distressing event that has happened to you. Traumas can include anything such as grief and loss, being a victim or witness to a crime, any form of abuse that could be physical, verbal, somebody forcing themselves on you in a sense, or exposing themselves to you in an inappropriate manner. Okay, financial exploitation; those are all could be considered traumatic. Okay, witnessing parents fight or divorce; those are all traumatic examples. Okay, examples of trauma, I should say. Family history of mental health, right? The therapist is going to say, in your family, any history of mental health. The therapist is also going to want to know about your lifestyle. So, what is your life like? Do you have hobbies? Do you have friends? What's your eating and sleep schedule like? Is your lifestyle just work and home? Or are there any activities that keep you committed? The evaluation process can be a lot because you are unpacking in that session, you know? So it is okay to give yourself a moment. Sometimes clients are surprised that, oh my goodness, I got emotional in the first session. I cried. I can't believe it, which is fine. Crying is a release. Your body's going through so much. So it's finally you're unloading, and that can be a lot. So it's okay to tell the therapist, I need a moment. I need to think. This is a lot for me. A good therapist will handhold you and walk you through this. A part of the evaluation also involves you asking the therapist questions. Okay, so you can ask the therapist questions like, okay, what are the next steps? So I'm here. I've told you everything about me. What's the next steps? So in therapy, we have a concept called a treatment plan. So basically, what that is you and I, as the therapist, we're going to sit down and come up with the treatment plan of how we're going to navigate this therapy process for you. A treatment plan also serves as a guideline of what we're going to do in therapy, right? So let's say you are coming to therapy because you're dealing with a lot of stress, right? So maybe the bigger picture, the long term goal is reduce your stress, right? And we're going to list some short term goals that's going to address ways to reduce the stress. Maybe we're going to start by talking about what's creating the stress. We're going to start by talking about exercising or, maybe dealing with relational stuff, right? You have to agree to the treatment plan. Sometimes some therapists will even let you sign the treatment plan. Any therapist that develops a treatment plan that you didn't know about, that's not an effective therapist. Because how can you work on something that you did not agree to? If you don't agree with whatever is on the treatment plan, it is your job to talk with the therapist and say why you don't agree with it. You know, it is your job to talk with the therapist to say, okay, I think maybe we can't do this, but let's adjust. As long as you are not avoiding or deflecting, the therapist should be able to work with you to develop a treatment plan that's going to be effective and realistic. Okay. You can also ask the questions, therapist questions about themselves. Last video, I talked about asking the therapist, what is their therapy style? What is their treatment modality? Sometimes I've had clients ask me if I see a therapist. I'm very honest and I'll answer and I'll let them know yes. A therapist is not required to see therapists, but they shouldn't have a harsh reaction like me, the therapist, seeing the therapist. No. If you get a harsh reaction, I have an issue with that because the therapist should not see themselves above seeing a therapist. I counsel a lot of therapists, okay? And we talk about how to help them so that they can help their clients. I also want to mention that a therapist seeing a therapist is not the same as supervision. Those are two separate things. Supervision is when a therapist is gaining their hours or is consulting with an advanced level therapist to process their cases. Those are two separate things, okay? In therapy, when a therapist goes to therapy, they're talking about their personal things. So those are two separate things. So a therapist might tell you that, yes, I get supervision. That's different. That's processing your cases. But if a therapist tells you I'm in therapy, then that's perfectly fine. Most graduate schools, when I was in graduate school, we had to do therapy so that we know what it feels like to be in the seat of the client. I'm only concerned if the therapist gives you a very harsh, like, why would I see a therapist question? Because at the end of the day, therapists are human beings too. So I see a therapist about every 3 months just for maintenance and check-in. I want you to treat the first 3 or 4 sessions as a trial run. Okay. So the first 3 or 4 sessions, think about this as a way to determine if I'm going to like this therapy process or not. It is perfectly fine if after the 4th session you decide, I think I want to try another therapist. But please do not use the first session as a measuring stick of how therapy is going to go, because the first session is an evaluation and we're asking a lot of questions. Sometimes some clients might feel a little bit put off by it. Keep in mind, sometimes a therapist will make the evaluation like a conversation. So you wouldn't even realize that you're talking with the therapist and getting evaluated. A good therapist can make the evaluation feel like a therapy session. Okay? Whatever you do, do not give up. Sometimes clients might see a therapist and say, you know what, I don't like that therapist, so I don't like therapy. Please try not to take one experience with the therapist and then transfer it to possible future therapists. Because as I mentioned in my last video, therapy can be like dating. I'm going to see you, I'm going to see you, I'm going to see you. And then when I find the right fit, then we're going to enter into a relationship. So whatever you do, please do not give up. Sometimes it's okay to say, you know what, that was a lot. I'm going to take a break. And then in a few months, I'm going to reevaluate and try to find another therapist. In my next video, I'm going to talk about how to determine whether therapy is working or not working. And I'm also going to talk about how to have a discharge session with the therapist, because sometimes that can be a little bit difficult. So stay tuned for my next video. See you all next time. Take care.